Hello everyone and welcome. My name is Tina and my partner's name is Nolan. Today we'll be going over the cervical spine muscle and ligamentous anatomy. To begin with, the cervical spine muscles are also known as the neck muscles and they have the greatest range of motion out of the whole spine. With that being said, due to the cervical spine being fairly mobile, it allows flexion, extension. So right here, flexion, extension, and also lateral flexion and rotation as well. Fun fact, you actually have more than 20 neck muscles that extend from the base of your skull and jaw down to your shoulder blades and collarbone. But today we will be focusing on the main muscles that attach to the cervical spine, which includes the levator scapulae, the sternocleidomastoid, the trapezius, and the suboccipital muscles. So altogether, they help support the cervical spine and contribute to movements of the head, the neck, shoulders, and the upper back, along with assisting with breathing, chewing, and swallowing. So if a cervical spine muscle, for example, is strained, it could become very painful and tight and could possibly lead to a stiff neck and chronic pain. Moreover, the three main ligaments in the neck that help stabilize the entire spine are the anterior and posterior longitudinal ligament and the ligamentum flava. Anyways, let's get into it, starting with the superficial muscles. Alright, so the first one up we have is the trapezius. We'll be mainly focusing on the upper trapezius right here. This portion right here, the little triangle. And it originates from the spinous process of C7, the external occipital protuberance, the medial third of the superior nuchal line of the occipital bone, and the ligamentum nuchae. And it inserts right into the posterior border of the lateral one-third of the clavicle, the acromion process, and also the spine of the scapula. And its innervation is the ventral rami of C3 and 4. And its action is to elevate and upwardly rotate the scapula and extends the neck. Next, we have the splenius capitis, so we can see it right here on the superior portion, and we can also see it right here. So it's deep over here, and it's in the intermediate layer over here. And so the splenius capitis originates from the nuchal ligament and spinous process of C7 to T3, and it inserts into the mastoid process of the temporal and occipital bone. Its innervation is the posterior rami of the spinal nerves C3 and 4, and its action is to extend, rotate, and laterally flex the head. Next, we have the sternocleidomastoid itself, the SCM. And so it originates from the manubrium and medial portion of the clavicle, and it inserts into the mastoid process of the temporal bone and the superior nuchal line. And the innervation is the accessory nerve. And its action is the lateral flexion, and it also rotates the head. Next, we'll be moving on to the deep muscles, and we'll start with the semispinalis capitis over here. And it can also be found right over there. And so it originates from the articular processes of the vertebrae C4 to C7, and also the transverse processes of vertebrae T1 to T6, and it inserts right in between the superior and inferior nuchal lines of the occipital bone, and the innervation is the descending branches of the greater occipital nerve C2 and spinal nerve C3, and its action is to extend the head, neck, and thorax, and it also rotates the head to the opposite side. Next, we have the longissimus capitis over here. And so it originates from the transverse processes of T1 to 5, and also the articular processes of C5 to 7. And it inserts into the posterior of the mastoid process of the temporal bone. And the innervation is the posterior rami of the spinal nerves, and its action is to extend, laterally flex, and rotate the head. And another muscle worth mentioning is the metaphysis cervicis. So we have it right here. And it originates from the superior articular processes of the vertebrae C4 to C7, and it inserts to the lateral aspect and tips of the spinous processes of vertebrae 2 to 5 levels above its origin. And its innervation is the medial branches of the posterior rami of the spinal nerves. And its actions is to extend, laterally flex, and rotate the spine. And next, Nolan will be talking about the suboccipital muscles and the cervical spine ligaments.
Hey everyone, I'm Nolan, and I'm going to be going over the suboccipital muscles and ligaments of the cervical spine. As you can see, down on the bottom left of our screen down here is our suboccipital muscle group that is comprised of 4 muscles, and they are posterior to the spinal column. This muscle group is located inferior to the occipital bone, hence the name suboccipital, and you can kind of see the occipital bone right there. And due to their relatively small size, they only perform fairly minimal movements of the head and neck. This little triangle gap shape here, this is where you can find the suboccipital nerve and also the vertebral artery that supplies these muscles. Now for the muscles themselves, this yellow colored muscle here is the rectus capitis posterior major. This muscle, when both sides contract, on this side and on this side, that will assist in neck extension. But if only, let's say, this side contracted, then there would be neck rotation to the left side. Next is this small purple muscle here. This is the rectus capitis posterior minor, and this muscle will help with neck extension. But again, since it is a small muscle, the neck extension is very minimal, and you're actually going to get most of the neck extension work from these bigger muscles up here. Next muscle we're looking at is this green muscle here. This is the obliquus capitis superior, and this muscle is going to help assist in extension of the neck when both sides are contracted bilaterally. But again, if only one side is contracted, then this muscle is actually going to help with lateral flexion of the neck or head. The last muscle of this group is the obliquus capitis inferior, which is responsible for both head extension when both sides are contracted, and then head rotation when it is only ipsilateral contraction. Moving on to the ligaments of the cervical neck. I'm actually going to zoom in here a little bit so it's a little easier to see. Starting here at the anterior longitudinal ligament, this ligament runs down the whole length of the anterior aspect of the whole spine, and its job is to prevent hyperextension when you're in back extension. On the opposite side of the spinal column is the posterior longitudinal ligament, which is easier to see on this diagram. This ligament will restrict excessive movements of the vertebrae in the posterior direction when the spine is in flexion. The next ligament here is the intertransverse ligament, and this ligament is seen in between the intertransverse processes of each vertebrae, and this ligament is on the lateral aspect of each vertebrae, and its job is to stabilize it when the spine is in lateral flexion. Moving back over to this side, this next ligament, the one that is a darker gray than the rest of them, this is the ligamenta flava or ligamentum flavum. This ligament connects the laminas of each vertebrae together so that when the spine moves, it will prevent hyperflexion and also keeps the vertebrae together via the laminae. Beside it, here is the interspinatus ligaments, and they, as you can see, run between each spinous process of each vertebrae. And this ligament is responsible for limiting hyperflexion while also helping to stabilize the vertebrae via the spinous processes. The last ligament is what's called the nuchal ligament. And this ligament is specific to just the cervical neck, and it's sort of an extension of the supraspinatus ligament that is found in the lower aspects of the spinal column. But as you can see, once it gets up to the cervical level, it expands and enlarges to attach to the occipital bone. And this ligament function is to support the cervical spine and head when it is in flexion, and also serves as a muscle attachment for other back muscles. Those are the suboccipital muscles and ligaments of the cervical spine. Here are some references we used, and thank you for watching.